Hello, hello, good evening, and welcome to Motivational Monday with me, your girl, Jackie O. Y'all, we have an amazing show for you this evening. Listen, as I was telling some of the ladies what we were going to be talking about today, they were like, oh my goodness, we are tuned in because we're talking about, yes, you heard it already, some of you, the M word. The M word no one wants to talk about. It's all happening right here on Motivational Monday with me, your girl, Jackie O. So we are super, super excited. Y'all, thank you so much for tuning in on this evening. Go ahead and let us know, excuse me, where you are tuning in from. Put it in the chat section. Let us know where you're tuning in from. If you have any questions, if you have any comments, you guys can also go ahead and drop them in the comment section on this evening. And so this evening, we are going to be talking to Dr. Gloria Richard Davis, and she is going to be sharing with us all things that we need to know about menopause. So I don't know if y'all are ready, but I am ready. So we are going to go ahead and introduce her. So the next thing you will see is a small introduction of Dr. Richard.
I'm Dr. Gloria Richard Davis. I'm a fertility specialist. I also specialize in perimenopause, menopausal care, along with other women health specialty at UMS.
Great.
From the beginning of treatment, the information that I gather from the patient is really used to develop a management plan that is compassionate, patient-centered, and comprehensive. I am an advocate of patient education because I think it's important for the patient to understand what their problem is and what the options are for them to be empowered in making that healthcare decision. I work with them as a partner in educating them and then listening to what they really want and how do we get to that endpoint that they want. The reason why I became a physician was to help people. But we get as much gratification from taking care of patients as the patients do in receiving care. And it always amazes me how much it really means to me to do a good job with my patients and to feel like we've done everything possible for them at the end of those visits.
Dr. Gloria Richard Davis currently serves as Executive Director for the Division of Diversity, Equity, and Inclusion, DDEI. She is the Director of Reproductive Endocrinology and Infertility in the Department of Obstetrics and Gynecology, and has been the Medical Director at the University of Arkansas Medical Sciences since 2013. As Executive Director for DDEI, she works directly with leadership at UAMS across 5 professional colleges and graduate studies, statewide and nationally, with a focus on increasing diversity in our workplace, creating a more inclusive environment, and elimination of health disparities in quest of health equity. As Division Director, she developed a comprehensive full-service fertility service from inception. Dr. Richard Davis has extensive experience and is board certified in both reproductive endocrinology and infertility and obstetrics and gynecology. Dr. Richard Davis is an oral board examiner for the American Board of Obstetrics and Gynecology. She has served and currently serves in leadership positions in numerous professional organizations. Her many years of research and active interest include health disparities, menopausal health, breast cancer in women of color, female sexual dysfunction, uterine fibroids, ovulation induction, reproduction endocrine disruptors, and assisted reproductive technologies. Most recently, she led the development of UAMS culinary medicine program utilizing the food as medicine curriculum, providing education to health professionals, community education, and research. Please help us welcome to our virtual stage, Dr. Gloria Richard Davis.
All right. Are y'all ready? Are you ready? Let's welcome Dr. Gloria Richard Davis. Welcome, Dr. Richard.
Thank you so much, Jackie O. What a very amazing introduction. You pulled out a lot of stuff there.
Well, thank you, ma'am. Thank you. And again, it is such an honor, and thank you for taking time out of your schedule on this evening to visit with us and to share with us about that M word that we're talking about. Let me
Absolutely.
tell you, it is so much around the word menopause that I think we do not know. So I am really ready for us just to dive in and learn some more information just about that M word.
Absolutely. Because it tends to be something that we kind of push to the back.
Hmm.
But I do believe that women are now opening up and discussing it more. So I'm really happy to have this conversation.
Yes, ma'am. Well, we're going to dive right into it. And the first question is, what is menopause? For those that may not know, what is it?
So, by definition, menopause means that a woman has stopped having menstrual cycles for at least 12 months. So we talk about perimenopause, which is that it may be 5 to 10 years preceding that, and then that year with no cycle, and then you are postmenopause, right? So it becomes a little bit confusing because you are menopausal, you really are postmenopause by the time we recognize that you're in menopause.
Okay. Okay. And so can you break down those stages of exactly the postmenopause and the perimenopause?
So, the stages of a woman's life really is we have adolescent where you have those kind of irregular cycles. Once the hypothalamic pituitary ovarian axis matures, then you start to have regular cycles, right? For most women. And that means that you're in that reproductive stage of life where you are fertile, you're able to have children, and then as you begin to get older, usually from a fertility perspective, we say age 40 and over, right? You may start to see some irregularity in your cycle. You may even have some of the same symptoms that menopausal women have: hot flushes, night sweats, sleep disturbances. But you're still having cycles, whether they're irregular or not. You're having those symptoms. So you are then perimenopause. You're not menopausal. Once you stop having a cycle, you have to count 12 months, no cycle. Then you are postmenopausal.
Okay.
Okay.
Okay. Okay. And that's good to know. And you touched a little bit about the like some of the side effects or some of the signs that you know that you're going into it, because I know I am in it. I'm like in it. So I have been researching myself because I am finding that I'm having like all these different little aches and pains. And I'm thinking, okay, what is happening? But as I'm researching, I'm finding out that it can be connected to me being in menopause. So as we're going into those stages, can you just explain a little bit more about the symptoms? Because the symptoms, it could be menopause and it may not be. So how would we know that we're entering into that stage?
So the symptoms, as I was saying, whether you are perimenopause or menopausal, may be the same. And
Mhm.
what happens is our ovaries produce estrogen when we're in our reproductive cycles, right? There are almost every organ system in our body has estrogen receptors. So estrogen is really critical for so many of the different function of our body, whether it is cognition, your heart has estrogen receptors, your GI system does, your bone, and certainly your reproductive organs have estrogen in it. And so when we think about some of the symptoms that occur, they're occurring because the estrogen levels are sputtering, right? In perimenopause, they're going up and down. And you're actually more symptomatic during that period of time because of those swings. So
Mm.
you have more hot flushes, night sweats, sleep disturbances. You might have that, what some of our patients describe as brain fog, right? And I say to our students and our residents, if you're on call every night and you don't get sleep, you don't get restful sleep, how do you feel the next day?
Yeah.
Feel tired.
Yeah.
Your cognition is not working as well as it should. You can't think. You're not as sharp, right?
Mhm.
And so that's really what's happening, is that sleep disturbance. You don't get into REM sleep, which is when we have our deep, restful sleep, right? And so those are symptoms associated with that. And then you add things like joint ache. Sometimes there's heart palpitations, headaches. Some women have headaches from estrogen withdrawal during their menstrual cycle, right? So, of course, you can have headaches during the perimenopause or menopause. And our bone and our skin is very estrogen sensitive. So we start to lose collagen. So we start to see a little bit more wrinkles, For our bone, we lose bone. And in that first probably 2 to 3 years, when you stop having menstrual cycle, you lose about 2 to 3% of bone per year.
Oh, wow.
So same thing is true with collagen. So those are significant years, and you can do something about those things, right? And
Right.
I'm sure we'll get into that.
Yes, yes. And so what are some of the myths and the facts surrounding menopause?
I think one of the biggest myths is that it's short-lived,
Mm.
right? I mean, and that's what they used to teach us as physicians, right? Oh, maybe a couple of years and you're through it. But we know that's not true anymore. The average woman spends 7 years or more in menopause. And for Black women, it's 10 or more years, right? So do you want to have those signs and symptoms and misery for that long a period of time and have it disrupt your quality of life, right?
Yeah.
So that, I think, is a big myth that we really need to get past.
Mhm.
And the other thing is, when you look at therapeutic options, I think women tend to think of over-the-counter or bioidentical as a more natural option. That's not true,
Mm.
because most of our pharmaceutical grade medications are plant-derived. But they have the benefit of having gone through very extensive clinical trials so that we know they're safe, right? So really pushing past that belief that, I can just pick up something on the shelf, or the compounding pharmacy can whip something up for me, and that's better than what my doctor will prescribe.
That's really good that you brought that up because, a lot of people, including myself, want to go the natural way, the natural route. And we hear, okay, do this, do that, and not just what you said, get the medicine that has been approved for us. And so that's really good to know because we may be doing our own selves a disjustice by taking things that's really not helping us and have not been FDA approved.
Absolutely. May not be helping you, and in some cases may be harming you. A lot of women are totally paralyzed by the fear of breast cancer, but yet they're willing to have pellets and injectables where their estrogen levels are tremendously higher than what they are from prescribed medications. So you have to think about all those things.
Right. Yes, that's so good to know. And we know that there is a stigma, but as you stated earlier, that's really kind of going away. We're more open to, talking about menopause and learning about it. But what was the stigma behind it? And why was it kind of like a hush hush type of thing?
I think, so much of it, when I think about our society, right, and what we value, we are infatuated with youth. And
Mhm.
so when you start to think about women in other cultures, Asian, African, they value wisdom, right? and aging, they have ceremonies, right, for women as they transition into menopause, because they really feel like, oh, wow, this is like, a new chapter has opened for them. But in our society, we're so really hell-bent on maintaining youth. It's kind of like that Ponce de Leon, right? Searching for that fountain of youth.
Yeah.
And we really need to recognize and push past that and begin to embrace who we are as we age. And as long as you're having good quality of life, right?
Mhm.
You feel good, you look good. If you're healthy, you eat healthy, you exercise, then you'll have a better quality of life, longer, longer life, greater longevity. And so
Yeah.
I think that's really part of what we need to come into, accepting.
Right. So accepting and embracing that,
Absolutely.
listen, this is going to happen. It's a part of life.
Yeah. And it doesn't have to be like my husband will say to me, well, why do you still color your hair? I color my hair because I like it that way. Okay.
Right. That is so true. Oh gosh. Well, Dr. Richard, we are really enjoying this conversation, and we're going to take a quick commercial break, everyone. And when we come back, we are going to talk a little bit more about menopause and the racial disparities that surrounds menopause. So we'll be right back after this commercial break.
Looking to be inspired and motivated? Join us for Motivational Monday with Jackie O every first Monday at 7 p.m. Central Standard Time, streaming live on our Facebook page and our YouTube channel. You can also follow us on Instagram at Jackie O. For more information on Jackie O, visit us at www.jackieo.com. Did you know that self-care is health-care? Self-care is defined by the steps a person can take to stay healthy mentally and physically. Especially for women, self-care can often take a back seat to caring for everyone else around them. Knowing that maintaining your health and well-being is the only way you'll have the capacity to care for others can be the first step in your own self-care routine. Don't know where to start on your self-care journey? Download our complimentary self-care planner and 30-day calendar, Oh Girl, It's Time to Glow, at www.jackieo.com. Sometimes you just need a little Kickstarter to get you going. There is nothing as powerful as a mother's love, and nothing as healing as a child's soul. Join us for a special Motivational Monday with me, your girl, Jackie O, the Mother's Day edition, on Monday, May 1st, as we chat with moms around the world on the challenges and the joys of motherhood. Nothing like a mother's love. We'll see you Monday, May 1st at 7 p.m. Central Standard Time with me, your girl, Jackie O.
Hey guys, well, welcome back. Thank you all for again tuning in. And this evening for our Motivational Monday, our topic is the M word no one wants to talk about. And our special guest is Dr. Gloria Richard Davis. And we have been talking about menopause, some of the myths and the facts, the stages, the side effects. Oh my goodness. We've been getting in it. But this part of the show, we want to talk a little bit more about the disparities, the racial disparities that we see when it comes to menopause. So, Dr. Richard, we know that, we need to advocate for our own health and see our doctors and our gynecologists when we're going through menopause and just in general for our health. Tell us, how important is it for us to see a specialist that specializes in menopause, and if we need to see a specialist that specializes in that?
So, that's a nuanced question, right? Because obstetrics and gynecology training is a women's health specialist. But I will tell you that in my residency and still within our residency training program, we do not get a lot of experience with caring for menopausal women. We are largely taking care of reproductive age women. obstetrics really dominates the field, right? And so when you start to seek care, you really do need to identify whether or not your provider is well versed in menopausal care. Now, there are some, general OBGYN who have gone the additional mile and have done certification training in menopause. So I'm not saying that they're all the same, but there is the North American Menopause Society, which is our national, international organization that has a certification process. And it's pretty extensive. You have to understand all of the physiology, what the therapeutic options are, what are the risks and benefits of one treatment versus another. And then you take a test, right? And so you have that certification, which basically says, yes, you have really made the additional effort to have that base knowledge. Not all primary care, internal medicine, family medicine, or obstetrics and gynecology providers do that. Mm-hmm. We do have within the North American Menopause Society, I was on their board for a number of years. It's a multidisciplinary organization. So we have OB-GYNs, internal medicine, family medicine, advanced practitioners, nurse practitioners, physician assistant. So it's a whole cadre of different disciplines that belongs to this organization, all of whom have decided this is important. This is an important part of my practice that I really want to enhance my knowledge in. Mm-hmm. So yeah. I would say, if you're seeing someone and you're not getting the answers you want, then you want to go to, and the website is menopause.org. Okay. So if you go to menopause.org, you can actually search for a North American certified menopause practitioner.
Okay, that's good. Menopause.org. And we'll be putting that in the comment section as well, everyone. So for those of you that are looking for physicians that specializes in menopause, you will be able to find them. Dr. Richard, so on this next question I have here, according to research that has been conducted, women of color reach menopause 8.5 months earlier than white women, and they have worse symptoms and do not receive adequate treatment. Tell us what causes that racial difference.
I think there are a multitude of answers. We had a longitudinal study, the Study of Women Across the Nation, or the SWAN study, mm-hmm. which has really contributed significantly to our understanding of the differences from a racial and ethnic perspective. So that particular study recruited women from like 7 different sites, but it's still not the end all be all, right, in studies, because it didn't cover a really broad swath of Americans. And when you look at the Southeastern region, where you have a greater density of Black women, we're not represented in that study. I do want to make sure we understand that, right? Okay. And so, but SWAN is the best that we have. And so when we look at the data from SWAN, it started to help us understand those differences. Black women, as you mentioned, have earlier menopause. They have greater severity in the symptoms that they experience, and they last longer. Now, when you think about earlier menopause, one of the things that I always step back and think about is we live in a very stressful society, and it's getting more stressful every day. Mm-hmm. With the racism and the social injustices that we're constantly being bombarded with, right? So whether it is on the news or whether it's in your everyday life, the micro and macro aggressions that we all experience. Well, that takes a toll on us. In fact, there's a specific term that's been dedicated to speaking to allostatic load, which is the stress load and the impact that it has on our bodies. It actually weathers us. It ages us. prematurely. And one of the things that we know when you look at our DNA, there are little caps on the DNA called telomere. And the telomeres are long when you're younger.
Mm.
As you age, they shorten because of the damage. And so what we see is a shortening of telomeres in Black people. And that corresponds to shorter life expectancy. We know when we look at, our life expectancy, we are short several years. If you look at men, probably 5 to 10 years difference compared to white men. And for women, yeah, we live longer, but we still don't live as long as our white counterparts. And I think that's really a huge part of it.
Yeah.
So figure out how to mitigate, right? You talk about self-care. I love that commercial.
Mhm.
That's what self-care does.
Yeah.
It reduces our stress and reduce the impact of it on our bodies.
Yeah. Yeah. And when you talked about that, I thought about the stress that it causes on our bodies, but how, in addition to self-care, we're taking care of ourselves, what other things can we do to have adequate care as we're going through menopause?
Well, some of the things I think, with the literature, when we look at how we seek information, right? Black women tend to seek information from their friends and families on menopause, as opposed to really looking at the medical profession, solid, validated information, right? Not based on what I experienced, right, as an individual, but really based on the literature. We have a huge body of publications that really looks at menopausal care in women. And so we should benefit from that. And we are looking more and more at those differences and how we really should be addressing and treating women. And then the other aspect is, and this is across all of women's healthcare, there is a tendency when we come in for care, we come in with a certain set of complaints, but they aren't really heard, right? A lot of times they're dismissed.
Mm-hmm.
And so if you walk in and you say, I'm coming in because I have hot flushes, night sweats, and your doctor is not really listening to you or saying, oh, it's not that bad, right? Then are you going to come back with the same complaint? You're not likely to. You're likely to just say, well, oh, you know what? He said it's not that bad. I'm just going to live with it.
Yeah.
As opposed to, you really should be looking for someone else, right?
Right.
Who listens to you, who has the depth of knowledge that's necessary to help you. And I'm not saying that all women need a prescription, but you need to be heard and you need to understand what those symptoms, what the impact those symptoms are having on your body, and not just the disturbances, but long-term sequelae.
Mm-hmm. And I love the comment you made about going to have another opinion.
Mm-hmm.
Because as you stated, a lot of times we'll stop just right there and say, oh, this is just how I'm going to be. I'll have to accept it. This is the pain. And sometimes we use Dr. Google.
Yes, yes.
Diagnose. But we really need to continue on, on our journey and really being an advocate for ourselves and for our health. Because if not, as you said, not all doctors, but there are some that will just be like, oh, okay, well, that's this, and really just kind of dismiss it.
Yeah, just kind of brush it off.
Yeah, push it off.
But making sure that you have taken the time to educate yourself.
Correct.
You have your questions prepared. And I even suggest that you might want to bring an advocate with you, right? Bring someone with you. Because the conversation and the dynamics is oftentimes different, or there are things that you don't hear that the other person hears, right?
Yeah.
Or if you've had that conversation with them, they may help to remind you, remember, you said blah, blah, blah is happening, right?
Right. Right.
So that may be necessary for some people.
Right. And I like how you said that about the advocate, because in this situation and in all situations, having an advocate, and we learned that a couple of years ago when my mother was sick and she had the Whipple surgery, which was a really major surgery. And we had to, me and my siblings, we were all there, and we would take notes when the doctors came in so that we could remember and, let her know, and just kind of really make sure that things were being done right. And so we were that advocate. And so I do agree that sometimes you may have to have someone else come along with you to take those notes and hear what the doctor is saying as well.
Right. That's exactly right. And don't wait, until the doctor is getting ready to leave the room to say, oh, by the way.
Correct.
Because once the hand hits the doorknob, the brain's off.
It's off. Yeah. That is so true. So true. Listen, guys, we are going to take one more quick commercial break, and we will be right back with Dr. Gloria Richard Davis as we are wrapping up our show on the M word no one wants to talk about. But listen, after this show, everybody's going to be wanting to talk about the M word. So we'll know. That's right. We'll be right back after this commercial break.
How can you feel more in control of your health and ongoing care? Be your own health advocate. Health advocates take control of their health care experience. You and your doctors make decisions as a team. You speak up with your questions, needs, concerns, and preferences. Take some time to think about your health goals. Ask yourself how you define a good quality of life, or what matters most to you when it comes to your health. As a health advocate, you have to do your part to take your medications as prescribed, follow your doctor's recommendations about diet, exercise, rest, smoking, and alcohol use. Remember, your health matters. Be your own health advocate.
All right. So again, we are talking about menopause, and right before the commercial break, that's exactly what we were talking about, is being your own health advocate and advocating for your health. And so that was my next question. We really kind of answered it already, of some of the ways that you can advocate for yourself, but you can go ahead and answer maybe some things that we did not cover of ways that you can advocate for yourself.
Well, there are certainly support groups. There are some online support groups, or there may be support groups in your area, right? That helps you to have that what we say our tribe, right? Mm-hmm. That supports you, that helps to spread valid, trusted information. And many of those support groups will have medical professionals who speak to them. So that's certainly worth looking into. Red Hot Mamas, we have a number of them in terms of brown girls, right?
Okay. And so what we can do, Dr. Richard, if you don't mind, you can just kind of give us some of those names of those support groups that we can definitely add to our caption. So those that are looking for support groups like that, they are able to reach out and get the help that they need. As we're wrapping up, what is something that you would just like to leave with our viewing audience on this evening?
I think one of the things is there may not be a specialist in your area, because we have women living in a rural area. We're all over the country. And we are now in a digital world, right? So you can reach a specialist no matter where you live, as long as you have a telephone, right? Okay. Because you can have a telehealth visit. And there are a number of organizations. I know that My Alloy has all NAM certified practitioners within their group, right? So you can reach out if you're not getting the care, if you don't have access to the care. Look towards some of those resources
Okay.
to get the care that you need.
Okay.
You have to settle.
That's right. So y'all do not settle. Continue to, because we all know if there's something going on with our bodies too. So
Absolutely.
continue to search and to seek until you get the answers that you need. And another good thing that you said that I really liked is to educate ourselves.
Yes.
Like we have to educate ourselves so that we will know what is happening. And another great takeaway is don't just get the opinions of your family, of Dr. Google, but talk to a specialist, and so you can get the proper information that you need for you, because each one of us are different. Our bodies are made up different. So what works for you may not work for me. So I love that takeaway. Well, Dr. Richard, we thank you again for taking time out of your schedule to be with us this evening on Motivational Monday with Jackie O. And we hope that you all, as a matter of fact, not we hope, we know that everyone that tuned in, you did receive some valuable information that you can take back and that you can use and you can pass along to others, because this is very important. Our health matters and we have to be our own healthcare advocate. So Dr. Richard, thank you for joining us. Thank you everyone for joining us. And we will see you all next month on April the 1st. I'm sorry, April. Oh my goodness. On May the 1st, for our very special edition, our Mother's Day edition. We're going to be talking to 5 mothers from around the world on their joys and their challenges of being a mom. So you don't want to miss that show. So we'll see you on next month, May the 1st, for Motivational Monday with me, your girl, Jackie O. And we pray that you guys have a good rest of your evening. Good night.
Thank you.